Graves' disease is a type of autoimmune disorder that causes the thyroid gland to become overproductive and produce too much of thyroid hormone. Thyroid gland secretes thyroxine hormone that regulates the heart rate, body temperature, blood pressure, and other important metabolic activities. It is a bit unusual autoimmune disease. Instead of destroying tissue like other autoimmune diseases, it produces abnormal antibodies that stimulate the thyroid to manufacture way too much hormone. It was first discovered by Sir Robert Graves, an eminent Irish surgeon, in the early part of 19th century. Graves' disease is one of the most common disorders of the thyroid gland. It accounts for 60 to 80% of hyperthyroid cases and most commonly affects people aged 20 to 50 years. Graves' disease affects about 1 in 200 people. It affects 2 to 5% of females at some time, with a female-to-male ratio of 7 to 1. Though primarily it is considered to be an autoimmune disorder, many other factors may contribute to it, including genetic and environmental factors. In Graves' disease, the autoimmune system targets the thyroid gland by creating thyroid-stimulating immunoglobulin. This immunoglobulin attaches itself to the surface of thyroid cells and compels it to produce thyroid hormones, leading to overproduction of thyroid hormones. Affected individual may either have a genetic susceptibility or may carry genes for Graves' disease. Various genes that may have a role in causing Graves' disease have been identified. Environmental factors that may trigger the development of Graves' disease include stress, infection, malnutrition, immune deficiency diseases, or pregnancy. Graves' disease is associated with gradual onset of symptoms, which often take several weeks or months to develop. Symptoms may include anxiety, nervousness, irritability, and difficulty falling asleep. Additional symptoms include weakness of muscles, intolerance to heat, unintended weight loss, fatigue, and a rapid and often irregular heartbeat. Abnormalities affecting the eyes are often referred to as Graves' ophthalmopathy. Less than 10% develop eye involvement that requires therapy. Common eye problems include bulging out of the eye from the orbit, which is its protective socket, dryness of eyes, puffy eyelids, retraction of eyelids, redness of eyes, and pain in eyes. Some individuals may complain of gritty sensation in the eyes, blurred or double vision, eye irritation, and increased sensitivity to bright lights. Very rarely, these individuals may develop a skin condition known as myxedema or pretibial dermopathy. This condition is characterized by the thick and reddish skin on the front portion of the shins. In exceptional cases, soft tissue swelling of the hands and clubbing of the fingers can be observed. Additional symptoms include palpitations, tremors of the hands, loss of hair, brittle nails, exaggerated reflexes, increased appetite, and an increase in the frequency of bowel movements. Females may experience disturbance in their menstrual cycles. Males may experience erectile dysfunction. Due to osteoporosis, the patients are susceptible to recurrent fractures. In the advanced cases, congestive heart failure can develop with life-threatening consequences. Because the thyroid gland regulates too many bodily processes and the symptoms have an incredible range of clinical presentations, it can take a while for the diagnostic workup to be started. A diagnosis of Graves' disease is made by careful medical history, a thorough clinical evaluation, thyroid hormone profile, and blood tests to detect the presence of specific antibodies. Primary goal of the treatment is to decrease the production of excessive thyroid hormones. Treatment usually involves the use of antithyroid drugs, use of radioactive iodine, or surgery. The specific form of treatment is based upon age of the affected individual, any coexisting conditions, and severity of the illness. Antithyroid drugs are especially preferred for mild cases, for the cases where prompt control is required, and for the treatment of young children and pregnant women. The most common antithyroid drug used in this condition is methimazole, with propylthiouracil being also used in specific instances, especially when Graves' disease affects early in pregnancy. Permanent therapy with radioactive iodine is the most common treatment followed in the U.S. In this therapy, the patients need to swallow a solution containing radioactive iodine, which goes through the bloodstream and accumulates in the thyroid gland. In the thyroid gland, the radiation-tagged iodine molecules selectively target and kill overactive cells. This shrinks the thyroid, and overproduction of thyroid hormones is stopped. Surgical removal of all or part of the thyroid gland is usually reserved for the persons in whom the other forms of treatment have either not been successful or cannot be prescribed. Mild cases involving eye abnormalities may be treated with sunglasses, artificial tears, eye ointments, or prisms that are attached to glasses. On the other hand, More serious involvement of eyes warrants the use of corticosteroids, such as prednisone. In most advanced cases, orbital decompression surgery and radiotherapy may be necessary. Lifelong follow-up and laboratory studies are usually necessary in majority of the cases. For more information on Graves' disease and to find list of expert doctors, hospitals, and ongoing clinical trials, please visit www.expertdocs.com.